I've taught people how to get the results that I get, because you have to produce results. If you don't, you can market all you want. You can act like you are the greatest thing since sliced bread. But if someone comes in your clinic and doesn't get better, nobody thinks you're good, okay? And then your brand starts to go down. But you ever heard that term, blinded by science? Like, people learn something and then that's all they can see, like you try to introduce things to them and they'll, no, this is what I believe, confirmation bias. I threw the book out and I looked at the body like a child, and like the basis of understanding orthopedics, right, that I learned in school. But what was wrong, I just put it out of my mind. And I said, I need to figure out what's wrong with these people. And the reason why I'm brutally honest is because I will do my role. I need to make sure that you do your role, okay? You have a role to do as a patient, and I have a role where it's a team effort. I'm not a magician. I don't fix people. This is a team effort. I don't BS people or, beg people to be my patient. Like, if you want to work with me, this is what it's going to take, okay? You need to do this, and if you can't do that, then I don't recommend it working with me. Hey everybody, what's up? Physical therapist, Dr. Whelton, coming to you from just outside of the Tampa Bay area. If you are new to following me, I am a physical therapist that I have a chronic pain clinic. So most of my patients, they come in here and they're exasperated with the medical system. They, may have had surgery, had injections, had physical therapy, had adjustments, and they a lot of times say they gave up going to doctors. They're just tired of it. And someone told them to give me a shot. And I've learned to get exceptional results within that patient population over the years. Become the go-to person when nobody knows what's wrong with you type thing. And the kicker is I've been teaching what I do for years because I develop protocols and diagnostic procedures. So I have all my courses that are online, but what I just did was I launched a membership, okay? So I'm teaching live now in my school group, SKOOL, school, under Whelton Methods. You can go to my VIP inner circle on my website, wheltonmethods.com, and click the drop down, go to VIP inner circle and join it. One of the groups is free. I teach live with live Q&A if you have questions for me. And then there's other groups in there where people can bring their patients in, and I go much more in depth, including all these, I'm an innovator, so I'm always coming up with new things, and I never know where to put things, like I don't want to constantly redo my courses. So what I did is I actually am putting them in these groups, okay? So if you're like me and you want to get the best results for your patients, inside the box, outside the box, whatever, then this is the group for you. So you can go to my website and do that now. Now, one of the things that I am doing, actually, before I get into today, one of the things that I am doing, so for years, I traveled this country teaching live way back before 2020, and it shocked me. Everywhere I went, somebody would come up to me in the class where I was teaching the myofascial method, and somebody would come up to me and they'd be like, hey, Ryan, would you help me open and run one of those clinics that you have, the cash-based clinic in Tampa that you have? And for years, I said no. I really wasn't something that was on my radar. And then finally, I'm like, you know what? A lot of these patients gave up going to people like me. They just have no respect for it type thing. They hurt me, that kind of thing. And I was like, but, if I can teach people not only the clinical part, but the business part, then we can get these people that gave up going to doctors. My hope is to get these people in your door and be able to help them. So I developed a highly successful cash-based clinic in Tampa that I have now taught to select numerous people, and they are doing well. So, I'm a very practical person. I like to be of use to society. And one of the reasons that I started teaching all this clinical stuff was because I was seeing people not getting better and the wrong rehabs being done. And I was like, yeah, no, I don't have problems with this in my clinic. Here you go. Here's what I do, that kind of thing, right? But when it comes to opening there's a million business coaches, right? I see them all the time. Now, they're all talking about charging more, like, charging cash-based businesses, how to charge more, right? But the thing that I see a hole is the most important thing about running a business is the service you provide. And the service to a patient, patients are bottom line people. They just want to get better. They want to be out of pain, they want to get better, and they want to get back to their life, right? But I don't see people talking about how to get people better. So this business course is going to be a hybrid course where not only do I work with you, hold your hand step by step and show you how I did this and helped all these people do this, how to open and run a clinic or transition from an insurance-based clinic to a cash-based clinic. But I will also be teaching like how I get my patients better, and if you have clinical questions for me, I'm your expert. Ask me, man. So it'll be a hybrid course. Here is how to open and run a cash-based clinic, from everything, from the finances to the marketing to the script, everything. And then here is how I get the results that I get. And I've taught people how to get the results that I get, because you have to produce results. If you don't, you can market all you want. You can act like you are the greatest thing since sliced bread. But if someone comes in your clinic and doesn't get better, nobody thinks you're good, okay? And then your brand starts to go down. So that's why people come in here and they say, I gave up going to doctors, but somebody said I had to come see you, right? Because I've been doing this a while, and word of mouth, and people are like, no, I failed everything too. Go to this guy. You know what I'm saying? So, but the kicker is that I teach what I do in here, so I'm not worried about it. Okay. So anyways, if you want to sign up for that, it's on my website, Whelton Academy, WheltonMethods.com. Okay. Now, today I am talking about tennis elbow. Okay. So tennis elbow, in school, they taught me golfer's elbow, you resist this, and tennis elbow resist, extension, flexion or extension, whatever. I don't like that test. I don't do that test. I want to just see if the person tore it or something, other than that, not a fan of that. I feel like physical therapy is common sense. This whole rehab thing is common sense, and sometimes that gets forgotten with all the smoke and mirrors in physical therapy, right? Everybody's saying something, right? Here's how I diagnose tennis elbow or golfer's elbow. For tennis elbow, I touch their lateral epicondyle. Mine does not hurt. Why would someone's lateral epicondyle, the common extensor tendon, hurt? Why would that happen? Because they have tendonitis, right? That's how I diagnose it, right? Do I do this just to make sure they didn't tear it? Sure. Almost never see that. But like the same thing with why would somebody hurt on the common flexor tendon? It's because they have golfer's elbow. You know what I'm saying? So yes, you can have a nerve entrapment, but nerve entrapments generally don't hurt to touch. They just have this vague symptoms in there type thing, tightness or pain or whatever coming down their arm, right? So anyways, that's how I diagnosed that, okay? But when it comes to tennis elbow, how I get them out of pain immediately. So years ago, for years, people have asked me, Ryan, how did you figure out what you did about SI joint? Here's the truth. I have an obsessive mind and I'm a dyslexic. So dyslexics are known for pattern recognition. A British intelligence agency actually recruits dyslexics like 3-to-1. They advertise it. They recruit 3-to-1 dyslexics over normal thinking people. Why? Because we're known for pattern recognition and we're very insightful, which is a synonym for intuitive. So we're born problem solvers. And when it comes to SI joint, people have asked me for years, like, hey, Ryan, how'd you figure out what you did? I read your paper, blah, 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 right? And this is how I figured it out, is I looked at SI patients and I was like, well, the pelvis only moves in 5, up slip, out flare, in flare, anterior, posterior rotation, right? So I just started playing around with my patients, and, I started moving the pelvis around, moving, this around, moving that around. And I started to notice a pattern. It popped out at me. And it was like, all my patients have upslips and or out flares with SI joint dysfunction. And by the way, these people have these crazy stories in the medical system about nobody knows what's wrong with them type thing. And I'm like, for me, that's how I figured out what was causing all my patients' SI joint patients, and I detail that in the case studies in my papers on my website. So, and the same thing with sacral dysfunctions was I started to look, I'd fix their SI and then they would complain of pain, like down in here, they'd go like that with their hand or at the base of their spine. And I started playing around with people's sacrums and evaluating it, not the way that they teach it. It's too complex, if you ask me. In my paper, root cause of sacral torsion, shear, anterior sacral tilt, on my website, I detail to you a new way to diagnose that. I streamline that. That's way too complex, the way that they teach it in school. I do SI and sacral for a living, and I don't believe I can make that diagnosis accurately every time. But the way that I show you, it's pretty straightforward, okay? So I also go much more in depth in my online rehab results course with that. So anyways, when it comes to tennis elbow, now I go much more into depth of my protocols for tennis elbow, but what I do with tennis elbow is to not only give the person relief, but also to confirm it, although there's really not much else that can go on there. Like I said, just touch them. If it hurts, then why would a common extensor tendon hurt, right? To touch, because I get tennis elbow. I do not rely on this. I don't believe in that test. Not that the reason why I don't believe it is because I sit across from people and they get tennis elbow. And I touch here, it hurts. I do this, they're like, nah, it doesn't hurt, And then I do the rehab and then they get better. And I'm like, yeah, I don't find that to be too reliable. So, there's two ways you can do this. You can read research, which, a lot of it's wrong. Meta-analysis are usually right, I find, but a lot of it's wrong, and it just like blinds you, But you ever heard that term blinded by science? Like people learn something and then that's all they can see, like you try to introduce things to them and they'll, no, this is what I believe, confirmation bias, right? And so I evaluate each thing. When I got into this profession, I looked at the body. Like for the first couple of years, I tried what I learned on my clinicals and in school, and I was like, yeah, no, this doesn't work. Like, a significant portions of my patients aren't getting better. That's unacceptable to me. And I'm like, I got to figure this out for these people. So I threw the book out, and I looked at the body like a child, and like the basis of understanding orthopedics, right, that I learned in school. But what was wrong, I just put it out of my mind. And I said, I need to figure out what's wrong with these people. And like I said, I'm a dyslexic, so I noticed patterns. We're known for that. And I noticed patterns, and I started seeing the same imbalances. And a lot of you guys are doing my courses and reading my papers, and you're like, oh yeah, I see the same imbalance now too. So anyways, let me show you how a quick way to Annette, can you come here for a second? Okay, so can you lay on your back facing up for me, please? So this is Inette, the Man in White of Physical Therapy. Okay, so somebody with tennis elbow, it hurts to touch. And if you just touch them, PT's common sense. If it hurts to touch them, then why would it hurt to touch them? Because they have tennis elbow. Now, you can do the extensor test, so hold, only push down, right? And just to make sure, what I'm doing is making sure that they don't have a tear, okay? But if you glide, what I found with, like I was talking about with my SI patients, is I just played around, and that's how I figured out what I figured out about SI. But what I found with tennis elbow is if you take the humeral radial joint, okay, this joint right here, radius, humerus, right here, and you have them like extend back like that, and go like that, yeah, like that, go like that, okay, and it hurts, right? And then what you do is turn their hand over, have them do it. And then what you do is you just do a posterior glide of the humeral radial joint, the radial head. You're mobilizing posteriorly for 4 out of 5 mobilization. I do about a grade 4. Now go ahead and extend that hand. Yeah. And then usually just have them go straight back like that. And if the person says, yeah, it doesn't hurt, then not only did you find what relieves their pain, but you're also seeing a major problem there, is that this usually works for me like pretty much every time, just to get them out of pain immediately. And then I fix the muscle imbalance associated with it. When tennis elbow patients come, thank you, Annette. When tennis elbow patients come to me, I'm not worried about it. The only thing that concerns me over the last, 15, 20 years of working with tennis elbow patients, the only thing that concerns me is if they cannot rest. okay? Because what you're dealing with is a tendonitis, okay? You're an overuse syndrome. It's very hard to fix an overuse syndrome when the person's using it, okay? Especially when the joint is dysfunctional in terms of the way it's sitting, okay? And the muscle imbalances that cause it. So anyways, I am not worried about it. I just need to make sure that the person rests. If someone is like a mechanic or something, or a house cleaner, and they're using their hands, I tell them to try to use the other one because you've got to rest that thing, okay? That is beyond important for tennis elbow is rest, okay? Rehab. But it usually, I would say it usually takes me 8 weeks. This is actually a longer rehab, I would say, for me. As far as tendinitises go, most tendinitises, I would say, in my clinic, like 5 weeks, something like that. But with tennis elbow, it's like 8-ish weeks, sometimes 5, but 8-ish weeks if they rest. If they don't rest, all bets are off. And I tell them that up front. You need to tell them that. You cannot just like hope they rest. You have to tell them. Tell them the parameters. If you're going to work with me, you need to rest. You know, people say like, you know, that come here, they leave comments and they're like, this guy's brutally honest. Yeah, no, I am. And the reason why I'm brutally honest is because I will do my role. I need to make sure that you do your role. Okay? You have a role to do as a patient, and I have a role where it's a team effort. I'm not a magician. I don't fix people. This is a team effort. If you want lasting changes, it takes effort. We have to change muscle imbalances, the way the joints are sitting, right? And that takes time. So I am upfront with people. I don't BS people or, beg people to be my patient. Like, if you want to work with me, this is what it's going to take, okay? You need to do this, and if you can't do that, then I don't recommend it, working with me. So anyways, rest is very important, and that's one thing that I make sure that I tell everybody before they start working with me, okay? So that's that. If you want to take my online rehab results course, or get a massive discount on it, on all my courses, then join my membership group. And I'm teaching constantly live on there with live Q&A, and you get a massive discount on my courses. Okay? Peace. Love you all.